Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita, and one of our co-hosts, Ron, is not with us today.
And I'm Jean Marie.
Collectively, we are the hosts of PodcastDX. On today's show, we are speaking with Pamela. Pamela is joining us once again from Victoria, British Columbia, up in Canada.
And we actually had the honor of speaking with Pamela last week regarding fibromyalgia. This week, Pamela is here to tell us all about her experience with the trigeminal neuralgia.
Okay, that's a mouthful.
Yeah.
In case you missed last week's episode, Pamela is happily married to her amazing husband, Ray, and they are the proud parents of 2 grown kids with 3 wonderful grandsons. Pamela worked for years whilst battling with pain from fibromyalgia and osteoarthritis while employed as an administrative specialist. She was also a certified event planner. With her career behind her now, and she is on long-term disability, she is now a blogger. I've always wanted to blog. I'm not into blogging, but maybe you can get me going on it. I need to.
Yep.
She writes about chronic pain, chronic fatigue, fibromyalgia, and invisible illness. In addition to blogging, Pamela is an active volunteer with the Patient Volunteer Network, or PVN, in British Columbia. Outside of the PVN, she has also done volunteer work for Island Health as a patient advisor. She was on the advisory committee for opioid guidelines in Canada and volunteered this summer with the Downtown Victoria Business Association Buskers Festival.
Hello again, Pamela, and might I say that I am just exhausted hearing about how much you do.
Yes.
But welcome back.
Yes.
Thanks so much for having me back again.
Pamela, I was reading over the data sheets for the conditions that have placed you on the long-term disability list, and I would venture to say that you have your plate full. We have separated,
I do.
Yes,
Yeah.
We have separated the 2 major conditions into the 2 separate episodes. We covered fibromyalgia last week, and that leaves this week with trigeminal neuralgia. First, to give our listeners an idea of exactly what we're talking about, what is trigeminal neuralgia?
Trigeminal neuralgia is a chronic pain condition. It involves the areas innervated by the 5th cranial nerve. So the area of the body involved is the face. It can cause severe pain even when doing simple things like brushing your teeth, shaving, putting on makeup, touching your face, eating, drinking, speaking, or even when something as simple as a breeze whispers across the face.
Oh, Pamela, you mentioned the 5th cranial nerve, and what is that exactly?
Okay, so the 5th cranial nerve is one of the most widely distributed nerves in the head.
Okay.
So the classic type of trigeminal neuralgia disorder, called type 1 or TN1, causes extreme sporadic sudden burning or shock-like pain, which may last from a few seconds to as long as 2 minutes per episode.
Mm-hmm.
Oh, gosh.
And episodes can often come in a series of attacks that last for several hours.
Oh,
But I have something called atypical TN,
okay.
which is when the pain comes in a long-lasting wave instead of a short burst.
That's not
So
better.
for me, it's like 100 little hammers are hitting the same area of my face
Oh my
for
God.
hour after hour.
Oh my God.
My episodes tend to last for 8 to 12 hours at a time.
Oh,
They start just under my right cheekbone, and then it spreads first to my sinus cavity, then down towards my jaw, and I often feel spasms in my esophagus as well.
Oh, my gosh.
wow.
Yeah.
Wow.
Not fun.
No. Wow.
Wow. I mean, my mouth hurts just
Yeah.
listening to you.
That's awful.
Mm-hmm.
Pamela, what causes trigeminal neuralgia?
And how can we avoid it?
Yeah.
Well, there's actually several possible causes for trigeminal neuralgia. So it sometimes begins as the result of the nerve sheath being too close to a blood vessel in the neck area
Okay.
where it exits the brain stem.
Okay.
In other cases, it can be caused by things like multiple sclerosis.
Which also takes away the
another-
sheath, right?
Yeah. Yeah.
Exactly. Another reason for this condition can be a tumor pressing on the nerve, or it might be the result of the wearing down of the sheath of the covering on the nerve.
Okay.
It could be the result of physical damage to the trigeminal nerve, perhaps from a sinus surgery or an oral surgery or stroke or other facial trauma.
Okay.
In my case, we suspect that the nerve is rubbing against something based on the MRI scan that I had done.
Oh, okay. Okay.
Well, can you tell us, I mean, obviously the pain, right? Is that what led you to find out what this diagnosis would be?
Yeah, the reason I was sought treatment was because I was suddenly having these pain episodes in my face. And after the first one or two, I realized they weren't just sinus infections because I wasn't showing any other symptoms that you would typically get with an infection.
Okay.
So I saw my doctor and I described the pain, and I was diagnosed with TN based on the description.
Oh.
And then when I was first put on medication, it stopped the episodes from happening. And that's when we knew that we'd made the right diagnosis.
Okay. Is it just a nerve pain type of a medication then?
Yeah, that's what we started with. It's
Okay.
one of the first drugs that they prescribed to you.
Okay. Well, while reading about this week's topic, I read that a person with trigeminal neuralgia might feel as if they had an abscessed tooth or, like you were saying, a sinus infection. And since it can affect the jaw area, it seems like that could make it a difficult condition to diagnose. I mean, like, is it a tooth? Is it
Sinuses?
Sinuses?
Yeah.
Is it the gum?
Yeah.
So it was not that difficult for you to get the diagnosis, though, huh?
No, like I said, just describing the pain to my doctor and how it flared into my sinuses first and then into my jaw helped him to realize that it wasn't an abscess in the jaw area.
Yeah, actually, what about a heart attack?
Yeah.
You
could have jaw pain.
Could it have jaw
Sure.
pain with the heart? There's a lot of things that
Yeah.
they could have worried about.
Well,
but I'm glad the doctor really thought about it right away.
You had someone that really understood what it was.
Understood it, right.
Yeah. And I understand that there are several tests that can be done to help determine the extent of the trigeminal neuralgia. Can you tell us a little bit more about this testing?
Yeah, so in most cases, the doctor starts by asking questions about your symptoms and asks about your medical history. Then they usually perform a physical examination of the head and the neck areas, including the ears, the mouth, the teeth, and the temporal mandibular joint, which is the TMJ.
Right, okay.
Other disorders that may cause facial pain and mimic TN type pain.
Okay.
They'll ask questions about that. So these conditions need to be ruled out first before a definitive diagnosis is made.
Mm-hmm.
And then often what they'll do is they'll order a magnetic resonance imaging, an MRI scan.
Okay.
They do that to rule out the presence of a brain tumor or multiple sclerosis or other causes.
Okay.
And the scan can also determine whether or not a blood vessel is pressing on the nerve. And so that's what my doctor did, was he ordered the MRI for me, and that's where we could see how the nerve was being compressed.
Okay.
Oh,
wow. Yeah, that's quite a few tests. I know that when we were talking last week, you said that during a procedure,
something was leaning
on a nerve. Now, could they have caused this?
Yeah.
Do you remember that?
Yeah, they could see that the blood vessel is pressing against the nerve.
Okay.
So it wasn't something that the doctor was leaning against. It's right now. It's just a blood vessel that's pressing. Because I'm just saying, like, what made the blood vessel all of a sudden press against the nerve? Do you see?
They're not really sure.
Okay.
Yeah,
right.
They're not really sure what's causing it to do that. And actually, until I undergo, some type of surgery, they wouldn't be able to say for certain until that happens.
Okay. When I don't know if I asked, when did this problem start compared to the fibromyalgia?
I've had the TN for probably about 14 years now, but I didn't realize that I had it in the beginning, simply because I thought it was a sinus infection. When I first had it, and the episodes were really infrequent in the beginning.
Okay.
So I just brushed it off. But when I started having them on a much more frequent basis, then I knew that there was a problem. And that's when I went to the doctor. So I would say 14 years in total, but, on a more frequent basis, probably over the last 4 years.
Okay. And Pamela, you said that some medications have helped a bit. Are there any other treatments available for patients with trigeminal neuralgia? Yeah,
there are treatments for trigeminal neuralgia which can help to reduce pain and improve quality of life. So what they normally do is they start off with a medication called carbamazepine, which is also known as Tegretol. That's the first drug of choice.
Okay.
And if that doesn't work, or if it stops working, as it did in my case, the other drugs that they use are called lamotrigine, gabapentin, and pregabalin. And then sometimes they'll use baclofen, which is a muscle relaxant.
Okay.
And then I also took a drug called topiramate, which I still take right now.
Yep.
Yeah, it's an anticonvulsant, and that worked for me for a long time, actually for almost 2 years.
Oh, wow.
But it has stopped working, and I am now at a point where I am having flare-ups about once a week.
Oh.
So, yeah. And so at this point, unfortunately, I have no other drug options left. I even tried Botox.
Okay.
Botox is often used as a last resort, where they inject Botox along the hairline, not into the actual area where you have the affection, but they do it along the hairline, and that's done to try and paralyze the muscles that are flaring up from the nerves.
Okay.
But that was unsuccessful for me as well. So now the only option left for me is a surgical option.
Oh, wow. That's, yeah. And you can't go back to a medication, like if you're on a medication for some time and it stops working.
There's once a medication stops working, it stops working, and you can't go back to the old ones again.
Okay.
They just
They're
don't work
ineffective.
again.
Okay. And Pamela, I really think we should let our listeners know that this is a disorder which is considered to be one of the most painful human conditions.
Yeah.
And just reading that statement makes me really cringe. In your opinion, how bad would you say the pain is?
Well, the nickname of this condition is the suicide disease.
Oh.
When I'm in a full TN flare-up, I'll be honest, I want to claw my face off. The pain is a 15 out of 10. It is absolutely unrelenting, and that's the worst of it. If I knew I was going to get relief in just a short period of time, it would be easier to bear. But when I get the telltale pulse under my cheekbone that a flare is coming up, I know that I'm in for 12 hours of agony. It's the most painful thing I have ever experienced.
I'm so sorry.
Oh, my goodness gracious.
Yeah, that's...
Yeah. And too bad they can't have like I know this, it sounds put you to sleep, like put you in a semi-coma, knock you, go in for a shot, like you go in for this.
Imitrex?
No, not Imitrex. No, the sleep that I went in for the shots.
Oh, okay, yeah.
There's times that I've debated going into the emergency room to see if there's anything that they can do to help me.
Right.
And I've gone once or twice, and I've said to them, I am in the middle of a TN flare-up, and I just want something to break the cycle of pain.
Right.
Yes.
And even when they've given me something, it hasn't always worked.
Oh.
The twilight, that's what I'm thinking.
Twilight sleep,
The twilight sleep, like
Yeah.
when they put you out temporarily while they're doing a
Yeah.
procedure.
Right.
I wonder have you tried that? Would that break it? I mean, you can
No,
even have that done at a dentist office.
They won't actually do something like that.
Okay.
The best that they'll do is they'll give me a shot. I'm allergic to morphine.
Yeah, so am I.
So the best that they'll do is they'll give me a shot of fentanyl.
Right.
But even fentanyl doesn't
touch it.
the pain.
Doesn't touch it.
No.
Okay.
Wow.
So I know that I'm going to, and actually I have to be honest with you, as we're talking, I can feel a tiny pulse in my cheekbone that there's going to be a flare-up coming up at some point
I'm so
in
sorry.
probably the next few hours.
Oh, man. Does meditation, does that help?
Nothing.
It sounds like that's like asking someone who's in labor. Oh.
No, I
have
figured
you tried
before it
meditation?
happens. I'm just thinking, I know.
okay,
I'm thinking
okay.
before it happens.
Nope.
Okay.
Yeah, I mean, I remember when I was first pregnant with this one over here, right?
Yeah. I don't remember it.
No,
so
she
well.
doesn't remember it, but I remember this. And I do have Alzheimer's, and I don't remember a lot of things. But I remember that when I was in labor, my husband at the time pulled out a deck of cards and said, "Would you like to play cards?"
You know what's really funny? I remember when my sister was in labor, and her husband pulled out a deck of cards.
What is it with these guys?
I don't know, but let's get back on track.
No.
Yeah. I mean, who the heck wants to play cards when you're in that much pain?
Okay.
It's not really a distraction, is it?
No, it's not. I wanted to take that deck of cards and...
Okay, and back to the show. Oh, boy.
Well, how has this particular disorder affected your family or friends or your interactions with them?
Well, when I'm in a flare, I can't do anything. I can't talk. I can't be around
Sure.
anyone. I mean, I'm just writhing in pain. I don't want to be touched or talked to. So any contact with my husband is out, and he's really good. He's really understanding about this, and he just makes himself scarce, and I
Sure.
just go to the bedroom in the dark and just cry.
So it's kind of like a migraine.
It is, yeah.
A little bit, but then, different. Yeah.
I want to isolate myself.
Right.
I just want to isolate myself. But my attacks are becoming so more frequent that it really interferes with my life.
Sure.
I mean, I don't want to socialize. I don't want to be around anyone.
Because you don't know if it's going to happen when you're out, right?
Right. Oh, I'm so
well,
sorry.
and that's the other thing. I never know when a flare is going to happen. I don't know if it's going to happen when I'm out. And if I am out, I just want to get home as quickly as possible. So it's ruined a lot of plans as well.
I'm so sorry.
Well, I hope that surgery option will work for you.
Well, I'm crossing my fingers. I do have an appointment with the neurosurgeon in April, so
okay, good.
I think we'll talk about that in a few minutes.
Yeah.
Yes, we will.
Yes.
We'll have to get you back on here in May.
Right.
We'll be praying for you in the meantime.
Yes. And are there any specific support groups for patients with trigeminal neuralgia? Because it sounds like the only person that can truly understand this is someone else that has the same condition.
Yep.
Yes, there are support groups available, and you can certainly look online to find one suitable for you.
Okay.
In the States, there's the American Association of Neuromuscular and Electrodiagnostic Medicine, which offers information and assistance.
I'll put that on the
they
website.
can be found, it'll be on the website. They can be found at aanem.org.
Okay.
And in Canada, there's the Trigeminal Neuralgia Association of Canada.
Okay.
They're known as TNAC, and they can be found at tnac.org.
Okay. I will put those on our website. Yeah, I didn't know if I told you,
so
but we build web pages for you and for your particular diagnosis on our website.
Oh, that's
so that'll be on there
so
forever.
People can find that information.
Yes.
That's great.
Yeah, we put links and resources so that people can have a one-stop stop to find out more about it.
Yeah, that's wonderful because, I mean, people, the support is just immense that, you can connect with people who are going through the same thing. And like you said, nobody knows what it's like except somebody who experiences it. So,
Absolutely.
I think it's really important that people know that there are national associations available out there for them.
That's good. And how about on Facebook? Are there those private groups?
I'm not sure about Facebook. There's probably lots of private groups that you can look for on Facebook.
Because I know that I join a bunch of them just so that I can glean information so that I can have a little bit better idea when I'm talking to a guest. And I can read all kinds of, interactions between patients that have these different issues. And, I had this, oh yes, we had that. And oh my God, do you remember when this? Oh yeah.
And have you tried this?
Yes. And all kinds of hints and tips. I love those.
Right.
Well, obviously we found out that this problem does not go away on its own, and it can get worse over time. And you are looking for possible surgery as a cure in the future.
That's right.
Have you been told to watch for any other symptoms, or is it just an increase in the severity?
It's really just an increase in the severity and the frequency that I have the flare-ups and stuff.
Okay.
Some people do achieve remission. Some people have flare-ups that go away.
Oh, good.
And they achieve remission. So that there is encouraging news.
Okay.
Some people, like myself, run out of options and need to look for treatments beyond medication.
Okay. And as we had mentioned earlier, that there may be surgical procedures to help alleviate some of the pain caused by trigeminal neuralgia. And like you said, your schedule coming
in
up.
April, right?
And that's
right. So I have an appointment on April 30th to see a neurosurgeon, and we're going to be talking about a brain surgery called microvascular decompression.
Okay.
So what that means is the surgeon will make a circular incision behind my right ear and remove that part of my scalp. And then using small tools, he'll find the trigeminal nerve and then place a small Teflon sponge between the nerve and whatever is compressing it, which is probably another nerve or, a tendon or whatever is in there.
Mm-hmm.
Okay.
But whatever's causing the irritation, he'll place the Teflon sponge between the two.
Okay.
And once that's done, the bone that was cut away will be covered with a titanium plate instead, and then the muscles and the skin are all sewn up again. And I'll spend one night in the ICU and then 1 or 2 nights in the hospital and then home to recover.
Okay.
So there's an excellent success rate with this particular surgery. And the reason I've chosen this surgery is because it has the lowest rate of causing facial numbness as well.
Okay.
There are other surgeries, including one called a sensory rhizotomy, which is the irreversible cutting of the trigeminal nerve root at its connection to the brain stem.
Okay.
There's gamma knife radiosurgery, which is a non-invasive outpatient procedure that uses highly focused radiation beams, and it destroys some of the trigeminal nerve root fibers that produce pain. And then there's peripheral neuroectomy.
Boy, you got to become you're becoming quite good with the medical terminology.
I really am, I tell you. But all three of those surgeries carry the side effect of facial numbness, and some to a really high degree. And I don't want that as a side effect.
Sure.
I researched all 4 of these different surgeries very carefully, and that's just not a side effect that I'm willing to put up with.
Sure.
Yeah.
Yeah, when your husband wants to give you a kiss, you'd like to know if he's close.
Well, exactly. And it sounds kind of funny to say it, but there's a lot to be said for that sensation of touch, and I'm not willing to give that up.
Absolutely.
Right.
Yeah. Absolutely. Do you have any additional tips, hints, or helpful advice for our listeners?
Well, my main advice is just to see your doctor as soon as possible if you're experiencing any type of facial pain. The sooner you get it diagnosed, the better. And if it is trigeminal neuralgia, there's help available. Find a good support group. Facebook has groups available to help. And most importantly, just know that you're not alone. There's lots of other people out there who are suffering. So, don't feel that you're the only one that's out there.
Well, thank you, Pamela. And how can our listeners learn more about you and trigeminal neuralgia?
I blog at PamelaJessen.com, and I have a few posts about my TN. So just do a search on my website to find them, and hopefully you'll get some help from reading those posts.
Okay, and we'll put a link on our website so that they can find you. Well, thank you, Pamela, once again for joining us. This has been wonderful.
Oh, it was a delight to be here again. Thank you so much for having me.
You're welcome. And we will be contacting you again in May to find out the rest of the story.
Yeah, see how everything in April
Wonderful. Goes. I'll certainly be happy to let you know what the surgeon has to say.
Great.
That's great.
And for our listeners, if you have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you liked today's episode, tell a friend. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Until next week.